What made you realize that analyzing a child's DNA using 3 hair strands could give us better outcomes than any off-the-shelf medication when it comes to autism?
See, if you see in today's world, most of the medicines are generalized. And for that disease, all the doctors prescribe those medicines. Now, one medicine which works for you may not work for the other person, because your DNA, the other person's DNA are different. So we have a machine who can analyze the DNA and then guide us to make the medicine for particular for that person. So we take 3 strands of the hair of that patient and place in the process. Machine verifies everything. Machine do the balancing and all those things and guide us what program, what medicine should be made, and accordingly the medicine is made.
What kind of changes parents can start seeing once they actually start this customized medication for their kids?
Mm-hmm. Actually, we are one of the very few centers, I think the only center, who does an integrative approach for the treatment of autism. Along with integrative treatments, we do customized DNA-based medicine, which I don't think anybody else does. Now, regarding your question about the outcome of the medicine, for the first week, you may not see so much improvement, but most of the people see improvement in the hyperactivity, the anger of the patients. What we have seen is their hyperactive nature reduces a bit. They become more calmer, their anger gets reduced. And as you continue with the medicine, you will see more improvement. Like in the 2nd or 3rd week, you will see that he's trying to speak, then he's trying to make friends. Usually autistic children do not like to interact with other children or even talk to their own brothers, sisters or parents. But you will see gradually they start showing more love. They start showing their emotions, making new friends. Okay, and by the 4th week, and let's say end of the 2nd month, they will start speaking more words. You will see that they will repeat your words. They'll start talking in the way they will start repeating some words. And of course, along with this, you have to continue with the occupational therapy, which will give much better result with the customized medicine, because every autistic child is different. His DNA is different. So when we make DNA-based medicine for him, so each child gets better result. We do not make a common medicine for everybody. Okay, so this is the advantage. So you have to take this medicine at least 6 months to 1 year. You have to continue, because he will keep on getting improvement along with their occupational therapy.
Ma'am, there's another question that comes to mind. In fact, a lot of parents would have that in mind. Mm-hmm. In fact, I was talking to a friend of mine in US. They have an autistic kid. So the question that they come to mind is sending the hair, getting a customized medication is one part of the thing, but they also want to know, are there any cases in your years of experience you have seen where this thing won't work? Because as you know, this is a lot of hope we are putting in something, and they don't want to be disappointed again, or at least the whole idea of being disappointed scares them. So have you seen any situation or any cases where this might not work or is not recommended?
As per our experience of so many years, we have seen remarkable improvement in the children up to 18 to 20 years. And they have seen significant results. However, I would suggest that if the child is above 20, we want to save you the disappointment. Okay, So we would recommend that if your child is up to age of 18 and 20, please do try the product. I'm sure it will help you.
What would you say to parents who have tried everything? I mean, people who have gone through therapies, they've tried different kinds of diet plans, they've tried different medications, different devices. Like the friend I was talking to yesterday in US, they pretty much tried everything from some modern neuro brain devices to some specialized diet plans. What would you tell them? I mean, how is this going to be any different than everything that they have tried and got disappointment?
Okay, firstly, I would say that we both are doctors. We are not sellers, or we are not selling medicines or products. We have spent more than 40 years in America as well as India, and this is a research-based product. Dr. Pravin Patel has researched for almost 40 years. He has been spending time in research and innovation. And as we have seen that autism is become a big pandemic, and we can understand what the children go through and what the mental agony the parents go through. And this was the reason why Dr. Patel decided to make this product to help such kind of children. And as you said, you have tried everything. I would say that try this. I'm sure it will work. It has given significant results. At least try for 3 months and you'll know the difference for yourself.
Thank you.